Hello, good afternoon. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Thank you and welcome to our weekend open clinic in YouTube. Today's topic is a topic that will be of best interest to so many women, especially if you're believing God to become a mother and if you've been looking for a baby for a long time. It's possible you might have this phenomenon, or it's possible you don't even know this phenomenon. It's possible. Now, there are some situations you will have all the classical signs of pregnancy, but you're not pregnant. What I mean, all the classical signs of pregnancy, pretty much everything that a pregnant woman will feel, first trimester, second trimester, even towards the third trimester, but you're not pregnant. This condition can happen to so many people. Though it's rare, it's possible you might be going through this. And it's something we need to understand better. That condition is called pseudocyesis. So that's going to be my topic this afternoon. So once you join, I can see the amazing admin already standing by. COO is standing by. Onyi is in the clinic. So please, this is very interesting topic. So I want everybody interested to please announce their location, and we're going to get the clinic started, and I'm going to take time to explain it better so you will understand it. There are so many conditions in medical practice that will actually query your sanity. This is one of them, and I want you to pay attention because it's really interesting. I'm going to start. After this particular clinic, please join me in our Facebook. I'm going to repeat exactly this topic in our Facebook. So if you're not able to participate in YouTube, follow through in Facebook immediately after this clinic. Where's my teaching aid? Okay, let's get things started. So in pseudocyesis, unfortunately, pseudo means false. So this condition is also called false pregnancy. In normal pregnancy, what happens? The penis will go in, release the semen. Semen is what you can see. Inside the semen is the sperm. The sperm will pass through the cervix. When the sperm passes through the cervix, it will get to the womb. It will go to the tubes. It's expected that by the time it's getting to the tubes, the eggs would have been released. So you have eggs in the tubes already, waiting for the sperm to come and fertilize the egg. Fertilization happens in the tube. After fertilization, the union of the egg and the sperm is called the embryo. They will start coming down to develop in the womb. This process is called implantation. This is the normal sequence of pregnancy. When you are pregnant, the placenta will emit the so-called pregnancy hormone, which is called beta HCG, beta human chorionic gonadotropin. That's the pregnancy hormone. When we check your urine, approximately 7 days after your missed period, we will pick up signals that you're pregnant. When we check your blood, way before the 7 days, we'll pick up signal that you're pregnant. When we check inside your womb with ultrasound, we will see evidence that you're pregnant. In this pseudocyesis, you will have all the classical, non-specific symptoms of pregnancy, but you are not pregnant. Urine test, negative. Blood test, negative. Ultrasound, negative. Now, we strongly believe that this is a psychological problem with some mental health undertones. It can also be due to hormonal factors. So in pseudocyesis specifically, a woman that is believing God for a baby, probably making love, probably checking all the boxes, will develop all the symptoms of pregnancy, but she's not pregnant. This type of situation is also called phantom pregnancy. You have all the symptoms, you feel pregnant, but ultrasound negative, urine negative, blood negative, no evidence that you're pregnant. Now, how common is this condition? It's very rare. It's as rare as 1 to 6 cases per 22,000 births. 1 to 6 cases of pseudocyesis per 22,000 live birth. So that's very rare. Most cases can be found in clients and patients between age 16 to age 39. It's important to understand that it's out there, but it's not common. Now, what's the difference between pseudocyesis and real pregnancy? I've already mentioned it and I'll keep mentioning it. When you are pregnant for real, your blood test will be positive. Your urine test will be positive. We will see evidence that pregnancy is developing inside your womb by seeing the gestational sac. We'll see another evidence we call gestational pole. In phantom pregnancy, in pseudocyesis, negative urine test, negative blood test, negative ultrasound, but you are still showing signs that you're pregnant when you're not pregnant. So that's the difference. What are the symptoms of pseudocyesis? Now, the symptoms of pseudocyesis are practically the same with actual pregnancy because you believe within yourself that you have pregnancy ongoing, but you don't. So most women will feel movement in their belly. And this is not imagination. It can actually happen to some women. You will start feeling unconsciously movement in your belly, which is not pregnancy. Now, some women will present with breast tenderness. Breast tenderness means your breast will be heavy, your partner will touch your breast, and you feel pain. Some women will begin to notice that their belly will be swollen, so you have enlarged abdomen. Some women will miss their period. Some women will add body weight. Some women will have morning sickness. Some women will begin to avoid some food and will begin to look for some food. Some women will have false contractions. So practically all the symptoms a pregnant woman will have, a woman that have phantom, false, or pseudocyesis will have them. Now, what causes pseudocyesis? We don't know exactly what might lead to this, but we know there is a connection between your psychology and some hormonal factors. So we consider this condition a somatic symptom disorder. In somatic symptom, you might be exhibiting some symptoms, but we might not be able to know what's going on. So you might have some physical symptoms of a condition without any medical explanation. So you might be having headaches and we can't really know where the headache is coming from. It's called somatic symptoms. But there are a couple of reasons that might actually lead to this in some women. When you have a strong desire to be pregnant, when you've had multiple miscarriages in the past, when you recently had a death in the family, especially of your baby, when you have been going through long-term infertility, if you are extremely fearful of becoming pregnant based on the experience you had in the past, if you have depression or anxiety disorder, if you have emotional trauma, if you have intimate partner violence or domestic violence, these are predisposing factors that might lead to phantom pregnancy, false pregnancy, pseudocyesis. They are the same thing. Now, what about the psychological factor that can predispose to false pregnancy? You see, the mind and body connection is very powerful. We believe that when you have intense desire to be pregnant, most times your body will conform. So you begin to experience changes in your body, and your body will begin to claim that you're pregnant when you're not pregnant. Now, other conditions like depression, infertility, miscarriage can also lead to hormonal changes in your body. Now, the hormonal factors that might lead to false pregnancy, some women might have some tumor. So tumor is a growth. Tumor can be benign if it's not cancer, or it can be malignant if it's cancer. There are some uterine cancers you might have or growth, and it will be exhibiting the pregnancy hormone. So there are some women that might have uterine cancer, ovarian cancer, and they will be producing beta HCG, human chorionic gonadotropin, but you're not pregnant. So any of these things can cause that. Now, you might be perimenopausal or you might be currently menopausal, and it will flip your whole hormones and it will be giving you symptoms as if you're pregnant. Symptoms like missed period, fatigue, weight gain, they can also be symptoms of menopause. So we believe that we have to make sure we have appropriate diagnosis of pseudocyesis. Among all the predisposing factors that can put you in this condition, the strong desire to be pregnant can impact your hormones and it can lead to pseudocyesis. How can we diagnose pseudocyesis? Definitely, we will perform what we call pelvic exams. If you go to the doctors, who palpate your belly, will look inside to see if truly what you're claiming is there. But more importantly, we run an ultrasound, we run a urine test, we run a blood test. Once you don't have any positive test, but you're still feeling the symptoms of pregnancy, and we have ruled out the tumor, then our diagnosis will be clear. So if forced pregnancy has occurred, the test will come back negative. So there will not be any urine test positive, no blood test positive, no ultrasound positive, but you will be so upset. You will be so disappointed. You will have a disbelief that all these symptoms you're having, there is no baby in your womb, but you strongly believe that a baby is developing in your womb, but you're not pregnant. So ultrasound is the best option to convince the lady that, my sister, you are not pregnant, you're going through this condition, and we need to support you the best way we can. So once we have eliminated the confirmation that you're not pregnant, then we will diagnose pseudocyesis. Now, can you get a pregnancy test positive with pseudocyesis? No. Pregnancy is all or none. It's either you're pregnant or you're not pregnant. So if you're not pregnant, you're not pregnant. Now, you can use your urine to check by yourself, or you go to the hospital for the blood. Like I mentioned, we have to get the blood test positive, urine test positive, ultrasound positive. What's the treatment for pseudocyesis? Now, there is no standardized treatment except helpful support, counseling. Once we've ruled out that you're not pregnant, we'll provide you sequential management. If we need to give you hormone therapy to balance your hormone, we'll do that. But the most important aspect of management of pseudocyesis is what? Psychological support. We have to counsel you. We have to, use what we call emotional support, behavioral therapy, and we have to allow you to talk to counselors so that you will understand truly that you're not pregnant. Then you begin to deal with your reality. So we also have to identify the factors that might be leading to you thinking you're pregnant when you're not pregnant. Now, as someone that is currently related to a woman that is having pseudocyesis, how can you help her? Compassionate support. You have to love them. You have to talk to them. You have to mourn with them. You have to allow them to express their anger, their sadness, their grief, their trauma. You have to be there for them. That's all you can do for them. Is pseudocyesis a delusional problem? It's not delusional. So long as what you're expressing is real, it's not delusion. Delusion is when what you're expressing is not real. So people that are diagnosed with pseudocyesis are not delusional. They just have pregnancy symptoms, but they're not pregnant. So it's not a delusion, okay? How long can someone experience this? Some women can experience this as far as 9 months, which is the duration of pregnancy. So it can be confusing. Now, how do you take care of yourself if you have pseudocyesis? Understand you need to be gentle to yourself. Pregnancy will eventually happen if you're within the range of pregnancy. If you're not within the range of pregnancy, there are other ways you can still become a mother. So be gentle to yourself. I know it will be painful to accept your reality, but you don't need to feel embarrassed. You don't need to feel ashamed. You don't need to disbelieve in you. You don't need to think that you failed. You just need to support yourself, be gentle to yourself, seek help, seek psychological help, go for counseling, understand what's going on. Be open to know about the feelings you are having, share your feelings, share your anger, share your frustration, but don't be in denial. If you can do all this by the special grace of God, you will bounce back and you will have normal pregnancy. At the end of the day, you become a mother. So in a nutshell, pseudocyesis or forced pregnancy is when you believe you are pregnant when you're not pregnant. When you have the physical symptoms like weight gain, morning sickness, and it can trick your body to believe you have conceived when you have not conceived. Despite the feeling of being pregnant, your body is telling you you're pregnant, but there is no evidence that you're pregnant. So ask for support from your loved one, from your healthcare, from your partner, from your parents. Talk to therapists. Talk to someone you trust. Talk to someone that will accept and help you to understand what's going on. Finally, talk to a fertility specialist so we can devise the best way to help you to become pregnant. That's my presentation this afternoon, and hopefully you will understand it better. But I'm going to open the clinic now, and I will give you opportunity to start asking your questions. So please go ahead and start asking your questions. The clinic is open now. It's very, very important you understand this condition. It's possible you're currently going through pseudocyesis. All right, let's see what we have. On day 14 of your frozen embryo transfer, you tested positive, very faint line, but your blood was negative. Was it chemical pregnancy? Now, the question is, where did you run this test? You see, sometimes you might have false positive test or false negative test. The standard time for checking for pregnancy when you go through IVF is 14 days. So if you have gone through these 14 days and the first test you got, you said you got negative test. So if I'm correct, you did this test with urine. Blood test is always superior. So if your blood test shows you're negative, unfortunately, my sister, you are not pregnant. It's not chemical pregnancy yet. Chemical pregnancy is a situation where you genuinely tested positive. Then down the lane, when the level of your beta HCG should be going up, it's actually going down or it will stabilize. That condition is called chemical pregnancy. Okay, but in your situation, unfortunately, you're not pregnant. So this is what you can do. Go to the hospital where they run this whole IVF process. Let the doctor be the person that will check. Sometimes, depending on one or few things, some women might have some 48 hours window to still be positive. So it's possible you might still test positive if we give you 2 days to come back and retest. It's also possible you might test positive if you check in a different lab, because some labs, especially if they are not reference lab, you might actually be pregnant and they're telling you you're not pregnant, or you might not be pregnant and they're telling you you're pregnant. So it's painful to go to a place they would deceive you and tell you you're pregnant when you're not pregnant, or they will tell you you are not pregnant when you're pregnant. It can happen in some labs. So go to the best lab in your community. Okay, please keep asking your questions. You can now open up and ask me all your questions. I expect this clinic to be sold out. Unfortunately, we have only 6 people, but that's okay. How will one know she's ovulating? Practically what I've been posting the whole of today. So there are some non-specific signs you might have when you are ovulating. Non-specific means you might have them, you are ovulating, or you might have them and you're not ovulating. The standard one is increase in your cervical mucus. So during the time you're ovulating, the mucus will start secreting some fluid, which will have the consistency of pap, which will have the consistency of, slimy pap. So that's cervical mucus. It can happen in some women when they're ovulating. Some women will notice mid-cycle pain. Some women will spot. Some women will have tenderness. Their breasts will be heavy. Some women will be midi. Some women will notice increase in their libido, increase in sexual desire. Some women will be craving for some food. Some women will be irritable. Some women will have generally some non-specific signs. Now, this is not specific. The only way to confirm you are ovulating is to go to a doctor. We collect a blood sample and we check for a particular hormone we call 21-day progesterone. The quantity of progesterone on day 21 will tell us for sure if you are ovulating or not. Okay? Why do IVF fail at times after spending heavily? Unfortunately, it's not automatic. So the criteria for success in IVF is dependent on the quality of the eggs, on the quality of the sperm, on the quality of the embryo, on the cover of your womb, and on the technicality of the person conducting the IVF. You see, IVF is very, very expensive. Now, I'm not necessarily bothered about the money. Trust me, money is paper. So anybody can borrow you millions and you can go and do this. It's the psychological trauma. It's the emotional roller coaster of going for those injections, of going for those investigations, and suddenly on day 14 it fails. So if you're going for IVF, let it be well planned. We can actually refer you to standardized, emotionally stable, experienced, user-friendly, caring, loving providers who will take your hand and explain all the steps. And if it fails, we explain it to you. We run our investigation. So unfortunately, in as much as IVF works for so many people, some people might need to go twice before their own will succeed. Some people might go twice, and some people might go the first time. Now we have a compiled PDF on all the important steps you need to understand about IVF. Admin, if it's possible, you can click the link and see if you can share it here. If not, you join us on our Facebook, and we're gonna share the link and you can get that PDF. Very, very important. Okay? Can pseudocyesis be said to be a psychological problem or a hormonal disorder? Both. It can be a form of your response to trauma. It can be a form of your response to emotional blackmail. It can be a form of your response to recurrent miscarriages. It can be a form of your response to long-term infertility. So yes, the psychological aspect of it is there. The mental health aspect of it is there. But it can also be hormonal. Because when you have a strong feeling, somehow you can control and configure your mind to believe in what you do and what you have. But I want your own to be concrete. So if you genuinely want to be a mother, I want you to also meet your intense feeling of wanting to become a mother by doing the right things, by seeking the right kind of help, by attending master classes, by going to a fertility specialist, not just praying and wanting to become pregnant, but you're not even making love. So it's possible it can be hormonal, it's possible it can be psychological. Can long-term infertility predispose one to pseudocyesis? Yes, that's actually one of the reasons why some women will have this. So if you have been wanting to become pregnant for the past 15 years, and about the time you see so many people around you becoming pregnant, your body will change. You will be beaten up physically, emotionally, psychologically, spiritually. You are no longer the person you used to be. It's possible you're depressed. You don't even know you have depression. It's possible you have sleep problems. It's possible you have anxiety problems. All these things can combine together to switch your hormones, to switch your stress hormone, and you will begin to see yourself as if you're pregnant, but you're not pregnant. So things like heavy breast, missed period, swollen belly, movement in your womb can all happen if you've had long-term infertility. This is why you need to talk to a real doctor who will understand your condition, and we have to rule out tumor. It's possible you might have cancer. It's possible you might have non-cancerous growth in your womb, and they will be giving out these signals as if you're pregnant when you're not pregnant. So very big contender in that possibility of pseudocyesis. Can cervical stenosis be caused by trauma from HSG? Very, very rare. HSG is a very carefully planned procedure. During HSG, what do? We make sure that everything is good with your system. We pass a special catheter. We make sure your cervix, it's actually free, and we pass through that catheter and we take a couple of pictures. We pass the fluid through and we take a couple of pictures. So going for your HSG is actually a helpful diagnostic procedure. There are some women that might have mouth blockage, and after HSG, the mouth blockage will be open because of the force of the fluid that will come in. So going for HSG is not a cause of cervical stenosis. However, women that have stenosis might notice for the first time they have stenosis when they are going for HSG because the probe cannot pass through the cervix. That's what happens, okay? The technician did not have any issues getting to your cervix. You did not bleed, but 1 year later, any woman can develop cervical stenosis. What you're doing, my sister, you're looking for who to blame. Going for HSG does not cause cervical stenosis. Absolutely not an etiology for that, okay? Can women who claim to be pregnant beyond the duration of pregnancy be going through pseudocyesis? Yes, that's also a classical, that one might have some delusional component. That one might have some component of going to places they will put you in denial. Pregnancy can only last for 42 weeks. Any pregnancy that goes beyond 42 weeks is called postpartum. We must deliver that baby immediately. Once your baby gets to 42 weeks, your baby is good to go. So women that come in and say, Doc, I've been carrying this pregnancy for 6 years, for 5 years, and suddenly I gave birth to a baby, it doesn't make sense, does it? It doesn't make sense. So yes, it's also a special type of pseudocyesis with some tinge of some psychological and mental health problems. An advanced pregnancy will go through first trimester, second trimester, third trimester. Once you've gone through 37 weeks, it's considered 10. That means your baby is good to go. When you give birth to your baby, you go home with your baby. So it doesn't make sense to listen to testimony. Oh, doc, I've been pregnant for 2 years, for 3 years, for 5 years, and suddenly I came to your church and you prayed for me and I gave birth to my baby. I've been pregnant for 5 years. Does it make sense? It doesn't make sense. I'm a Christian. There are so many things people talk to me or tell me about, and I just smile because they're just using the fact you're desperate to tell you all these BS. It doesn't exist, okay? So don't worry about that. All right, so do we have any other further question? We still have 5 minutes. If not, we're going to quickly go to our Facebook and continue the conversation. There is no association between yeast infection and cervical issues. Yeast infection is caused by Candida albicans, the commonest, completely treatable. It does not have any association with your cervix. Now, what are the things that can affect the nature of your cervix? Previous surgeries, or maybe you've gone for pap smear and we suspected you have some cancerous growth and we collected some sample from there, or you have overwhelming pelvic inflammatory disease, or you went for illegal abortion and it caused extensive scarifications, which will lead to Asherman syndrome. But there is no association between Candida, between Staph aureus, and your fertility, and anything that happens in the whole body. Completely unrelated. And Candida and Staphylococcus aureus are not sexually transmitted infection. The only sexually transmitted infections that can impact your fertility and your ability to become pregnant is what? Chlamydia and gonorrhea. If you have hidden chlamydia and gonorrhea, poorly treated or undiagnosed, they can go to your tubes. They will damage your tubes to the extent that when you now want to start having babies, lo and behold, your tubes are blocked. That's what happens. Okay? All right. Is cervical stenosis purely medical, or can it be as a result of physiological trauma? It can be unknown. It can be iatrogenic. So in course of going for a couple of procedures inside the cervix, if they damage the cervix, it can happen because anytime you have any damage in the body, our body heals with what we call first intention. If your body heals with first intention, you wouldn't even know you had those damage. That's how most surgical wounds will heal. But when your body heals with what we call second intention, your body will heal with scar tissues. So if you went for illegal abortion, if you went for a procedure in the wrong place, they can damage your womb. They can damage your cervix. They can damage your vagina. And when it's healing, it will heal with adhesions. So women that have cervical stenosis, their cervix will be gummed together like this. And when your cervix is gummed together, the sperm cannot enter and you will not become pregnant. Okay? The understanding of what benign means is very important. Benign means it's not cancer. Cervical stenosis is not a growth. Cervical stenosis simply means we can't gain access to your womb because the cervix is gummed together. It's not a growth. It's not a cancer. It's not a benign condition. So absolutely no connection. Okay? Okay, Kenna, you meant psychological trauma, correct? Like vaginismus, correct? Now we can classify them in the neighborhood of the unknown. So in vaginismus, you've probably been raped, abused in the past, and for some reason, the whole musculature of your vagina has refused to relax. Remember, for you to engage in lovemaking, the vagina muscles has to relax. So in women that have vaginismus, there is no relaxation. That vagina is in a constant stage of contraction. So the vagina cannot free itself up. So the woman can never open up to engage in lovemaking. So there is no connection between vaginismus, which can be psychologically related, and cervical stenosis. So they are not connected. But I love those questions. I love these probing questions. It helps me to think beyond the box. Okay? All right, guys. I love the engagement this afternoon. And hopefully we've learned one or few things. I'm sure you've been noticing some ads when I'm presenting. It's all part of the Facebook package. Sorry, YouTube package. So join me in Facebook in a few minutes. I'm going to tell you one or few things. Then I'll be back in Facebook. You don't want to miss this conversation. Okay? Okay, I have one more question before I go. Yes, cervical stenosis can be corrected, minor surgical procedure, and you'll be fine. You had to miscarry 2 months ago, your prolactin is high, your pallidal, your M2, you're supposed to see your period last week. Go to your doctor, my dear. Okay, you can have all this and you're not pregnant, and it might be coming from your partner. So there are so many things that will lead to lack of pregnancy when you're not pregnant. Okay? Thank you so much for coming. I appreciate you guys. Please join me in our Facebook in a few minutes and we'll continue the conversation. Bye-bye for now and God bless.